Good afternoon. Our program will begin in just a moment. Just as a reminder, we will be recording our program and a link will be sent out. Looks like we have a few who may be having trouble connecting, but it looks like I see about 300 or so that have joined so far. So just as a housekeeping, we will be using our question and answer panel. So if you'd like to ask a question to one of our panelists, please enter your comments there and we'll relay them. If we don't get a chance to respond to them today, we will get that information out to you this week. Well, welcome. My name is Warren Bear, and I wanted to share with you just a little bit of information about the Lehigh Valley Health Network. It is comprised of 8 hospital campuses, plus lots of health centers, physician practices, rehab locations, express care sites, and other outpatient care locations in 7 counties here in eastern Pennsylvania. We have over 19,000 colleagues who are daily contributing to LVHN's mission, which is to heal, comfort, and care for the people in our community. We're trying to make those communities healthier and better places to live. I wanted to share with you LVHN's core values. They are compassion, being kind, integrity, doing what is right, collaboration, being a good partner, and excellence, achieving the best outcomes. And I think those core values are all very well highlighted in our patient blood management and bloodless surgery program. So I'm excited for you to learn about the ways that we can serve patients who request treatment without the use of blood products. So we have multiple attendees today. For some of you who I haven't had a chance to meet formally, my name is Warren Bear. And in June of 2019, I joined LVHN as their coordinator for patient blood management and bloodless medicine and surgery. I've been involved with patient blood management and bloodless surgery for about 20 years now. And I started working in this field down in Jacksonville, Florida at Baptist Health, and then spent 11 years in Michigan at Bronson Methodist Hospital, integrating blood management principles into their health system. Since the summer of 2019, a fantastic team has quietly been working on establishing a robust framework for addressing patient blood management and bloodless medicine and surgery at Lehigh Valley. This has been a long journey and involved the work of hundreds of passionate colleagues of all types within our organization. And I am very proud to share with you some resources for care without blood products here in the Lehigh Valley that you may not have felt you had access to previously. Now, I wanted to talk about blood management and bloodless surgery, the differences between those. Blood management is often product related. How are we managing our finite blood supply, right? When it comes to transfusions of red blood cells, platelets, and plasma, are there ways that we can approach the administration of these products to transfuse fewer units and still provide optimal care? Now, there's a great deal of clinical data that shows us that transfusion, specifically of red blood cells, can be a marker of the type of care we're receiving. More units can sometimes mean less quality care because those can carry additional harm to our patients. Now, to someone with a blood management focus, getting someone like a cardiac surgeon to switch from transfusing 2 units of blood to just 1 unit of blood, well, that's a pretty big win. But with a product-based focus, we miss a major component of excellent care, the person that we're treating. And that's why our program reminds all of the colleagues that a patient comes first, literally. Our patient blood management program reinforces the patient-centered focus, the realization that the more skilled we are at delivering the right care at the right time, the closer we stick to the latest and best practice guidelines within transfusion therapy, the better outcomes our patients will have. Now today, we're here to talk about the bloodless medicine and surgery arm of our program. That means how we can support and care for the patient who refuses blood bank products. Now you want the best standard of care, you just want it without the inclusion of donated blood. And there could be a range of reasons that bring you to that decision. Perhaps someone you know or member of your family was negatively affected by a blood transfusion, and that makes you cautious of the donor pool. Perhaps it's a deeply held religious belief. Or maybe you're just interested in alternatives and want to know more about how we use these techniques. Well, we'll touch on some of these specifics today, and in later programs, we'll dive into medications that use blood fractions or how we can use techniques with your own blood to provide alternatives to transfusions. But today, we wanted to specifically address the why behind the decision to invest time, resources, and energy into creating the strong framework for substantive bloodless medicine and surgery options for patients right here in the Lehigh Valley area. So I'm thrilled to introduce you to some key members of our team and for you to hear from one of our patients. Let's move on to our agenda this afternoon. Dr. Elizabeth Flodine is our first participant today. And for some of our providers who may have to run unexpectedly into surgery or take an emergency patient call, we find it helpful to record their presentations in case they can't join us. Now, fortunately for us, Dr. Flodine is here today, so we'll watch her video, and then she's graciously agreed to take a few questions. So feel free to use that question and answer section, and then I'll pull a couple of those to have Dr. Flodine respond to. Let's watch her video now.
My name is Dr. Beth Flodine, and I am one of the generalist OBGYNs with the LVPG OB-GYN practice, Chief of Gynecology, OB-GYN Vice Chair of Muhlenberg Hospital, and a member of the Patient Blood Management and Bloodless Surgery program at Lehigh Valley Health Network. From a gynecological surgery standpoint, bloodless surgery is my goal for every case and every patient. I implement the use of minimally invasive techniques such as the Da Vinci robot for the majority of my hysterectomies. When I meet with someone in the preoperative settings and they express their desire for no transfusions or bloodless surgery, I tailor their approach to their needs and wishes. The number one cause of hysterectomies in the United States are fibroids. Fibroids are benign tumors that can cause pain and usually heavy periods. Because of this, a lot of my patients come to me that are anemic. I commonly give medications to help stop heavy bleeding prior to surgery and also work closely with our hematology colleagues to help bring up the patient's blood count with IV iron infusions prior to their surgical date. For cases that are bigger and we cannot complete via the minimally invasive approach, such as very large fibroids or for other reasons, there are things that we implement during surgery and intra-op, such as albumin, which is given in the pre-op setting, and that increases the patient's blood plasma levels, and also cell saver technology. This is something that collects the blood directly from the patient into a machine, cleans off unnecessary fat and tissue, and collects it in case the patient needs it later on during the surgery. From an obstetrical standpoint, Lehigh Valley Health Network has been caring for Jehovah's Witness patients safely for many years. We're a large practice that is made up of physicians, midwives, nurse practitioners, and physician assistants who take a team approach to provide the best and safest care to all of our patients. Women can expect at their first OB visit to be given a blood refusal consent that goes over all the individual blood products that women may or may not decide to receive. We know that every Jehovah's Witness patient woman is different, has different beliefs. So that's why we make an individualized approach to each patient that we see. All of our patients get blood levels checked multiple times throughout pregnancy. Anemia is a common thing that we do see in pregnancy or in our pregnant population. And just like with our gynecologic surgical patients, we work closely with hematology and commonly send patients for IV iron transfusions or infusions. I'm certain that intrapartum or postpartum hemorrhage are a concern for a lot of our Jehovah Witness patients. But you can rest assured at Lehigh Valley that we have a set protocol for medications and certain things that we do to help prevent or decrease blood loss in these situations. The entire obstetrical team, including the anesthesiologist, your labor and delivery nurse, your delivering provider, are all well aware and are educated on our postpartum hemorrhage clinical practice guidelines. We also do simulations a couple times a year in our simulation center, specifically on postpartum hemorrhage, that is attended by the residents, the attendings, labor and delivery nurses. So we are well educated and ready for anything that might arise in the intrapartum and postpartum setting. My name is Dr. Beth Lodine, and I am one of the Bloodless surgery champions at Lehigh Valley Health Network.
So, Dr. Flodine, there are some questions that we have for you that we'd love for you to weigh in on, if you could. First, thank you so much for explaining some of your background and how you approach a patient. That's super valuable information for us to have. One of the things that you mentioned in your intro to us was that you have that preference for the robotic approach in your procedure. So why does that, why do you prefer that method for the majority of your cases?
So the robotic approach has benefits over like regular straight stick laparoscopy for mainly two reasons. One reason is that the visualization is a lot better. I'm looking inside a 3D console as opposed to looking at a 2D screen. And also the instruments for the robot move like my wrist as opposed to just regular like straight instruments. So better visualization and better instruments. And also one of the instruments that I use at the robot cauterizes and cuts the tissue at the same time. So that alone leads to an overall decreased blood loss for these cases.
I can see how that would be especially beneficial for the Jehovah's Witness patient who doesn't want to accept any blood products. So that's nice to be able to know. So is there something that determines if a patient is a good candidate for robotic surgery or not?
I would say the only patients that are not candidates would be ones that have very large fibroids, just because of where we have to stick the ports for the robot. So that is why it's very important for women to get in to see their gynecologist on a yearly basis. That way we're catching these fibroids and operating on them before they get to that point.
And you mentioned your team too. I really like that because it's not just you that's on your own doing all this, even though we view you as a super person. But you have a whole team behind you, and that is really appreciated. So how would someone go about transferring their care over to you or to your team?
From an obstetrical standpoint, we have, I think, 14 offices now located around the valley. We have some in Lehighton, we have one in Quakertown, we have one in Palmerton, all over the valley. So you would just go to like the LVPG OB-GYN websites, and you can find an office that's convenient for you and just call and make an appointment.
Okay, that's great information. Here's an interesting question that's coming through. You mentioned having filled out uh, a form or a care plan that
Yes.
explains a person's wishes. Why is that important, do you think? And what was the point about doing that at each time? And why do you do that?
So for my GYN surgery patients, we usually will either sign a blood consent or a blood refusal. So the blood refusal on it has like albumin, obviously red blood cells. I'm trying to remember the whole long list of things that we have on there that patients can either agree or refuse. And I have some patients who will refuse everything, even albumin. And I have some patients who will agree with certain things. So same thing with our obstetrical patients. Early on in their pregnancy, we had them filled it out, scanned it into their charts, and then when they come in labor and delivery, we review it again. but it's because every person is different and every person has different beliefs. So we don't want to assume that one person has the same beliefs as somebody else.
That's a nice point. I'm glad you brought that out too, because especially when it comes to that Jehovah's Witness patient, you may see one that accepts, like you said, the entire range of additional products, and then some who are fairly conservative in what additional fractions or medical procedures they will accept.
Yeah.
Okay. All right. Yeah. Thank you then. So then we have one question here. I just wanted to run past you. You said the bloodless approach it being your standard care. That's what you shoot for every surgery. Was that correct in
Yes.
us saying that? Yeah.
I'm
Okay.
pretty sure every surgeon shoots for less blood loss.
Well, and as we look at particular surgeons and the champions that we want to be on our team, they're ones who align very closely with what you just said. They're already of the mindset that they want to reduce blood loss as much as possible. Then when a patient comes to them and they say, "Well, I refuse these blood products," you're already kind of in the zone to be
Right.
able to do that, right?
Yeah.
Okay. All right. Well, Dr. Flodian, thank you so much for being with us today. Appreciate your
Sure.
time and thank
Thanks
you
for
for
having me.
answering. Yeah, we appreciate that. Thanks so much. And just as a note, we're going to provide Dr. Flodian's office information and contact details on slides at the conclusion of our program for any who are interested in following up there. So next on our agenda is a roundtable discussion, and that's one that I've really been looking forward to. You see here several boxes of people that are going to be speaking to you, and one of them is Pat Tiselli, who it's my honor to introduce now. Dr. Pat Tiselli is our Chief Medical Officer and Vice Chair of the Department of Surgery at Lehigh Valley Hospital, Muhlenberg. He's the Chief Medical Officer of the Lehigh Valley Hospital, Hecktown Oaks in Easton. I'm just going to share just a little bit about his background. For over a decade, Pat, you've served as a member of the Surgical Executive Committee, the Surgical Leadership Committee, and the Surgical Quality Council. You've served on the Network Patient Safety and Quality Committee, and for a couple of years, you were the president of the Pennsylvania National Surgical Quality Improvement Consortium. Your leadership was critical to the network's enhanced recovery after surgery program. You have numerous professional positions, awards, and honors. The role that I get to interact with you the most is the one of being one of the medical directors of our patient blood management program, specifically on the surgical side. And frankly, Pat, I think if we were to go through your entire bio, we wouldn't really get to talk about anything else. So I'll stop there, but it's certainly evident that you are well qualified and that your viewpoint and counsel is definitely respected at the Lehigh Valley Health Network. So I thought you would be uniquely positioned to be involved in this first educational opportunity to our community. And this is kind of an interesting opportunity for our attendees today because oftentimes we share a lot of facts and figures. We share nuts and bolts about specific medications or procedures. We talk about the reduction in blood transfusions and why the medical evidence supports patient blood management. But today, in this first setting, we really wanted to address more of the backstory, right? The human component, why we started patient blood management and bloodless surgery. So from your administrative background, can you share with me some of that backstory? Why are we even here today talking about this situation?
So, Warren, first of all, thank you for inviting me today. As you know, LVHN has always been positioned with a full array of surgical and medical specialists and subspecialists to care for patients that, for whatever reason, decline to receive blood transfusions. Likewise, we have cutting-edge medical technology and information systems to support their care. And in the past, we have even sporadically cared for patients declining blood, but it wasn't intentional. Quite frankly, we were perceived as not friendly to the bloodless community. So we envisioned the type of program we wanted to create for our community members, but were unsure how to get there. Something was missing. So after visiting our other established patient blood management programs, we identified 3 opportunities. We needed to change. We needed to change from a culture of physician-directed decision-making to a culture of patient-centered decision-making. In other words, we needed to listen to our patients. We recognized we had an underappreciation for outcome data, which showed no difference in outcomes when transfusions were restricted. And I think more importantly, to be successful, we needed to build a relationship-based patient blood management program built on a foundation of respect for those that chose not to receive blood. We needed to embrace the knowledge and experience of our surrounding hospital liaison committee members and move forward together to provide the level of medical care required while at the same time respecting the wishes of the patient.
Pat, thanks for sharing that with us. I think the connection to the patient really comes through in that, doesn't it? It enables us to be able to see that, and that's something I really have always appreciated about you as a surgeon. I think you retain that connection to the patient that is very admirable, and it really does come through. And I know that that's part of the team approach as well. In fact, I wanted to share one thing. This was one of um, the early changes that speaks to what you mentioned, that we really did want to make something substantive, that we wanted to share and to partner with these patients. And so one of the very first things that we had to do was address the way that as a network we talked about the blood refusal process. So before, it was a very short form that basically only talked about the drawbacks that could come from the refusal of blood. Now, we know risks and benefits, that's an important decision and discussion that we need to have with providers. But really what we could do at the same time was marry that to a form that is very inclusive of care plans and that really brings out important information that a patient might need to be able to have the best possible outcome. And so I'm very proud that one of the very first changes that we made as soon as we decided to do this as a network was to completely revamp this consent that we have. And as Dr. Flodine mentioned, um, to be able to see right away what's on the table and what's off the table. So here, instead of only being a blood refusal form, this also opens up what alternatives are available for patients. So as you come into any one of our network hospitals, you'll be able to look at the options that are available. So not just I accept or don't accept, but what types of things can we do for these patients? So going back to Dr. Flodine's point earlier about the specific interventions, here you'll see that you'll be asked to let us know, are these things on the table for us? Can we use things like albumin, erythropoietin, immunoglobulin? Are the clotting factors that we have that are derived from human or animal products okay with you to be able to use? How can we treat your own blood within medical procedures? Are you okay with blood coming out, being modified, and then being reintroduced back into your circulatory system? All of these things can help to plan and make sure that our patients have that best possible outcome. So as you think about this, and I know a lot of your work is administrative now, but you are grounded in surgery and patient care. So from the viewpoint of a surgeon who has literally tens of thousands of surgeries under his belt, how is having a detailed consent like that one that outlines all the available alternatives, how can that be a real plus for a surgical team?
So Warren, one of the keys to any successful surgery and outcomes is planning. in being aware of your options. For those that decline blood, that starts with preoperative management of anemia. Our hematologists have created pathways and matching order sets to optimize the patient's hemoglobin without blood transfusions. With the input of the HLC, as you just alluded to, we created a new, extremely comprehensive consent form that guides both the surgeon and the patient to make very detailed decisions in regard to blood products and other blood conserving choices. So this produces clarity for the entire healthcare team and reassurance for the patient.
Well put. Thanks for clarifying that for us. So in a sense, really, the bloodless part of bloodless medicine and surgery, it doesn't really come into play as much until the rubber really hits the road, right? Almost anyone could say, yeah, I do bloodless surgery, until there's a problem. So this proactive planning, this making sure that our patients are built up and that their blood health is in excellent shape before they can come into an elective procedure, making sure that we have all these tools that are available for these best outcomes, that's so crucial to a program, a formal program that says we can treat you in this way. So really, in effect, what we can say is that it boils down to us being partners in education with our patients, because the better educated they are, the better that we can help them. So I think this is a good time to introduce Kelly Frenzy at this point. So Kelly has been with Lehigh Valley Health Network for about 15 years now, and she's worked in a number of different departments, the Division of Education, Risk Management. She's been in cardiology. While she was there, she served on an initial committee that was exploring patient blood management options, the PBM Initiative Committee. So this was before our formal program was established. And then after her work on that committee, she was invited to serve as our Bloodless Medicine and Surgery Patient Liaison. So Kelly, that's a long title. What does that even mean? What does the Bloodless Medicine and Surgery Patient Liaison at Lehigh Valley Health Network do?
Yes, that could be a mouthful for sure, Warren. Well, I would have to say, if you really look at what a patient liaison would do, it's kind of like a mix, Warren, of a navigator, an advocate, as well as an educator. And what I found to be with this position is that it doesn't start with the patient when they arrive in the hospital. It actually starts well before they come to the hospital for their surgery. So usually how my role begins with a potential patient for our program is I like to have a one-on-one discussion with them, find out what their needs are, so that I can get them linked with the appropriate surgeon and the appropriate specialty. Once that happens and we follow up with a consult, and that patient now has their decisions made as to what their personal choice is as to how they would like to be treated, then it takes on a different role. Then I make sure that everyone on that patient's care team, so that would include pre-staging, the anesthesiology team, post-operative nursing staff. It's important that all of them understand what this particular patient wants for their care. So that's where it goes into, I would say, the advocate role.
Yeah, so you wear a lot of different hats then. Yeah, I can appreciate that. So, and I know our patients do as well. I'm really interested though in one thing that you mentioned, because you're hitting on a theme that Dr. Flodine mentioned and Dr. Tuselli both mentioned about education, because
Yes.
an educated patient is one that is more comfortable, right? And how can we help our patients be completely informed about their choices regarding blood fractions and medical procedures involving their own blood? Is there a role that you have in being able to help educate our patients like that?
Yes, I do. And as you mentioned, we all can appreciate the importance of a patient being educated. In fact, it really can lead to a positive outcome for that patient. But We know that these decisions are very important. Some, as we mentioned, are based on because of their beliefs and their faith. But along with that, some patients are just overwhelmed when it comes to this topic. So we were trying really hard to make sure that our educational materials and publications and brochures were very simple. We worked very hard so that it would be in a simple format so that the options were laid out there and that the patient could make an informed choice as to how they would personally like to be treated. So here's a good example, Warren, on our screen. Here's one of our educational pieces that we use with our potential patients, and I'm sure Dr. Flodine's familiar with this as well. As you see, we wanted to make sure that we talked about, okay, there's blood components, but then there's also the difference of blood fractions. And so you see across the top, it talks about what those particular blood fractions are, where they're derived from, as well as how they can be used and used in this particular patient's care. And then over to the right, you'll see one that deals with what you spoke about, medical procedures that uses the patient's own blood. We wanted to make sure that we were very detailed as to what these procedures involved so that the patient was truly informed as to how they would work with their care. And so once again, the patient would be informed and know how they would like to choose to be treated with. This served very helpful, as it was mentioned, to Dr. Flodine about making sure that she understood how this particular patient would want to be treated, because each one has their own personal choice. So we feel really good about our educational pieces, knowing that they are very clear and simple for a patient to understand.
Yeah, I agree. I like that. And I like how it chains back to that consent form that we have.
Mhm.
So if we're able to run through these educational pieces and help someone understand, then that consent form seems a lot less daunting now. They know why those medications might be used. They know if those medical procedures are on the table. And then from there, they can have that informed discussion with their provider. Is this going to be used in my surgery? If so, when would it be? And so they can get those questions answered. So I appreciate that. Thank you for sharing that. Along with I think an important point that you mentioned about your role is that you kind of tie all the distinct pieces through the spectrum of care together. So not just the surgeon knows about this. Now the care team within the OR, the anesthesiologist, the perfusionist, the techs that are there, pre-op, the nursing knows about it. We've got everybody from the nurses on the floor that the patient is going to go to afterward that knows this care plan and is able to be on the same page with the patient. Literally, when we're talking about the page of the consent, right?
Correct, that's true.
So I see that is an important role. And it's kind of a distinction between a hospital or a health system that approaches bloodless medicine versus just finding a surgeon who may be able to provide that standard of care for us. It really gets a lot more allies on the team, doesn't it?
It does.
Yeah. Okay. Well, thank you, Kelly. Pat, let me get you to jump back in here for a moment because I know you and I have talked about this particular subject at length and from the first time we met, actually. But how important was it to have the structure and framework, the real base of a robust program for bloodless medicine in place before we had an event like this, before we introduced ourselves to the community and said, hey, we're an option for you here at the Lehigh Valley Health Network?
Warren, as you just said, from the beginning, we have felt very strongly about not being held to a timeline for creating and launching our patient blood management program. Instead, we chose a slow, arduous path that has taken us nearly 2 years. Education takes time because every person at every touch point needs to be knowledgeable and aware that patients declining blood are handled differently. And if you still aren't certain what to do, you need to know who to call. The supporting electronic medical record system required a completely new design, starting with bloodless identification, patient alerts, best practice guidelines, and reminders for specialized blood collection. Concomitantly, we were assembling and educating our bloodless surgery provider staff about our philosophy, patient-centeredness. So all these initiatives took time. We didn't want to start a program just to start a program.
I like that phrase you used. We didn't want to start a program to start a program. It's easy to get a few dollars for marketing set aside to put out a billboard and hang a shingle out, but that doesn't mean that an institution is really ready. So I do appreciate those points that you mentioned. Now, all of that, you encompassed it or encapsulated it really well. All of that, though, if you unpack it, that's a huge undertaking. It's a real shift in our philosophical approach to a patient, and it includes so many pieces. So Kelly, let me ask you, what are some of the big projects that you've worked on to make sure that we can support our bloodless patients?
Well, Warren, I would have to say, in addition to the education piece, we also understood the importance of identifying these type of patients who did not want blood transfusions in their care as soon as possible. So with that said, we were focused on we should get armbands. That would be a good alert to have. And I honestly thought, Warren, this would be very easy. I have to tell you, for this being one of my projects, I was surprised at how challenging it became, but nevertheless, we got it done. So when we were talking about using wristbands that would say no blood, we found out we couldn't just go and buy a bunch of bands and have it on the floor and we're ready to use. That would have been nice, but we really had to back it up with having policies in place that would really support when and how we should be using these bands, these wristbands. So then on to the next piece was the logistic part of it. We wanted to make sure that every floor, every unit had it, that it was easily accessible for the nursing staff so that no matter where the patient was going through their care, if they got identified and they didn't have a band, that band would have been placed right on the patient as well. So like I said, I learned very quickly it was more than just putting a wristband on a patient. I would say that that was my first big project, but I follow that up with also the topic of pediatric tubes. That's a big piece of what we do for patients who really want to minimize their blood loss due to lab draws. And regarding the pediatric tubes, we wanted to make sure that our nursing staff felt comfortable using it. Certainly, we wanted to make sure we had them readily available, but not every nurse at Lehigh Valley Hospital knew how to work with a pediatric tube. So we really had to call on some of our colleagues in nursing education to help us with learning modules for our nurses, as well as we even had nurses from our pediatric hospital come over to the floors and work with our nurses to help them get comfortable using a pediatric tube. And once again, we had to have policies in place for using pediatric tubes and the right way to use them and when to use them, as well as the logistics of having it readily available in every floor and every unit. So along with those two, I would say I'm also very proud of our website, Warren. Our bloodless surgery patient blood management website, I have to say, is, I like your word, very robust, because it's constantly updated with a list of our surgeons who are participating in our bloodless surgery program. So you can go there to see the different specialties, who our providers are. Along with there, you can access our educational materials and our brochures. And it's also a nice platform for you to hear and read about previous patients who went through our patient blood management program and what they experience, what their patient experience was at Lehigh Valley Health Network.
Yeah, that's a lot, and I really appreciate that, Kelly. I think we talked about that once your email inbox and call routing sheet got to about 100 when we were
Yes.
talking. So it's, I think, in the hundreds of communications to get these projects off the ground. So thank you for your work that you've done there, and thank you for mentioning our website as well, because a lot of the questions that are coming through on these question and answer are, is it possible to get copies of these forms? Can we get some of these screenshots so that we can see these and prepare ahead of time? And definitely, those are available, those educational materials, through our website. At the end of the presentation, we'll have some easy links so that you'll be able to get over there too. So we'll be able to follow that up some more. I want to share with you one thing too. I think I'll mention the work that we did to integrate bloodless medicine into our electronic medical health record. Now that, if you talk about a big job, was gigantic, and it took the work of a very dedicated team of individuals and some very smart people to get in and basically build from the ground up a new way to approach our patients. And so we talked about some of the things that we do. How do we integrate that into the medical record? So as soon as a patient comes in, how are they identified? How can they get that assistance? Well, I want to share with you something that we gave our physicians to be able to help them. So providers, our advanced practice colleagues, anybody who comes in to deliver care can be reminded and be assisted to help these patients in the best way possible. So we use an electronic medical record called Epic. And Epic is what is tied to you as you come in as a patient, and it has all the information from all the care points that you've reached before. And so it kind of helps us to keep everything in one place. And so one of the things that we've done is to be able to make sure that we have a way to identify patients who refuse blood transfusions. So here's a banner that you'll see that is on the left side of your screen, and that pulls up anytime one of three conditions are met. And the condition could be a provider has placed on your chart a note that you have refused blood products in the past. It could be that you've identified yourself as a practicing Jehovah's Witness. That will also put this blood products refusal banner up. And also, if anybody within our health system puts on a flag on your account that says blood products refusal. So if any of those three conditions are met, you will have a giant yellow bar right above your, or right below your picture that says blood products refusal. Now, we went a step further too. We said, what if someone accidentally tries to order blood products on a patient who has identified themselves as a blood products refusal patient? Well, in that case, a new box pops up. It stops them from actually entering. In this case, it's a request for a red blood cell transfusion. And as you notice up there in the yellow, it says, this patient refuses blood products transfusion. You must review this decision with the patient or family before proceeding with this order. And so then you have to actually click twice to determine if that is actually a real situation. And at this point, if it was just an accident and the patient verifies that they don't want a transfusion, they would back right out of that right now. We've also got an interesting care guidance message that populates to any of the providers on a weekly basis that just says, we just want to let you know this patient refuses blood products. Please consider discontinuing any standing lab orders. So that means blood draws that we might automatically put on a patient. Wait a second, let me stop and think. If I have a patient who refuses blood transfusions, do I really need for this one to go through every day? Or is this something that I can use on a every other day, or maybe even a weekly basis? One of the other things that we tried to do within the medical records is to be able to optimize anemia, to find out if it's there, and to correct it ahead of time. And so on an outpatient basis, a surgeon can very easily do what Dr. Flodine mentioned she routinely does: get the patient over to the hematology consult and the colleagues there in our outpatient hematology center. They can do a number of different things to build up a patient's blood health. What they do need to be able to accomplish that is a request, and they need 4 different blood tests to be able to make sure that they can optimize this patient. So in this case, we've made it very easy with the click of 2 buttons. A provider can go to Bloodless Medicine Orders. They can click this Bloodless Medicine PAT, and it will automatically pre-select the 4 tests that they need. And then you will see right in the middle, they have an e-consult to hematology. And then the reason for consult would be bloodless medicine. We've got some fantastic colleagues over in our hematology department, and they take seriously the matter of building up a patient's blood health prior to a surgery. So you can see for a patient who doesn't want to accept a transfusion why that pre-work is so important. Within the inpatient setting, we've also made it very easy to get hematology to come and see you while you're at the hospital. So it's, again, a very easy order to go in, request a bloodless medicine consult, and then you can see they can also consult to our department, the blood management and bloodless surgery department. They can get hospitalists involved. They can put in a request if they see you don't have that armband to put one of those on you. They can also just pre-select that they want to use pediatric tubes that Kelly was talking about before. So those are some of the really interesting things that we've been able to do with our electronic medical record to make sure that we can support the bloodless patient. And again, as we talked about, those are enormous undertakings. Those are things that that definitely take a while to become approved, for the work to be done, and then to educate all of our providers about that. So that was a big project. I'll add that one to your list, Kelly, of the things that we've done. So thank you very much. Now, I want to go back to something that I heard from you, Dr. Tiselli, earlier. You mentioned that the HLC group. So for those of you who are not really aware of what that group is, within the Jehovah's Witness organization, this Hospital Liaison Committee, or HLC for short, is almost like a medical support staff within that congregational structure. So for those attendees who might be of the Jehovah's Witness faith who are here with us today, can you talk about why we felt it was really important to have a good relationship with that group?
I think you saved the most important question for last, Warren. As I said earlier, as a network, we've always had the provider staff in modern technologies to support the patient blood management program. But we knew something was missing. Patients didn't feel comfortable coming to us. They weren't made to feel at ease. And our demeanor and actions weren't thought of as being genuine and intentional. Our network needed something to differentiate itself if this program was going to be successful. It became apparent that we needed to create a patient blood management program by looking through the patient's eyes. And we realized probably the best set of eyes to accomplish that was the Hospital Liaison Committee. We needed to align our program with the HLC, and by doing so, we would benefit not only from their detailed and comprehensive medical knowledge of consents, medical treatment options, algorithms for patients declining transfusions, but even more importantly, from their spiritual guidance. So we hope this develops into a long relationship of mutual understanding, respect, and trust that can steer our program so patients can finally feel at home.
I like that sentiment. Thank you, and appreciate that it's backed up by that recognition that there's such a nice resource for us there. So Kelly, why don't you jump in? How do you interface with that Hospital Liaison Committee group?
Well, first, Warren, I just want to say I totally agree with what Dr. Tiselli just mentioned. You know, it's not just the physical health of a patient that's important, but we're all firm believers the spiritual care as well is just as important. So with that said, I interact with the HLC daily. I keep in touch with them daily. And so if a patient desires that they want to make contact with an HLC representative, I can assist with coordinating that. As well as if an HLC representative needs to get in touch with a patient, I can play a role in that and try to assist them as well. I also like to, when we have a new provider who wants to be a part of our bloodless surgery program, I think it's important for them to meet with the HLC members. You know, we talked about how important it is that we're all on the same page. And I think with them meeting with an HLC representative and they hear how their program interacts with our program, how we all work together, it helps the physician and the provider to really see that the HLC can be a useful resource for them as well.
Yeah, that's a nice point, Kelly. Thank you. And speaking back to Pat's portion about having that ability to be able to recognize them as that resource. I know one of the things that we've tried to do is to invite them on a quarterly basis to our patient blood management committee meetings so that other clinicians can appreciate the role that they can play there. So I think that's really important that you mentioned that. So thank you for interfacing there with that. Now, I think we do have a few questions. I've enjoyed our conversation so much, and we're actually going just a little bit over, but maybe if we could just take one or two questions, let's do that. So, Pat, one of the things that I've seen, and I'll ask you to weigh in on this from the surgical standpoint, one of the questions here, what are some of the surgical interventions to prevent or treat blood loss?
So Warren, we're running a little behind schedule. I could talk for a long time about this because this is a very common question. So I think before I talk a few minutes about the intraoperative strategies, for completeness, there are two other strategies that I think I should mention: preoperatively and postoperatively. So preoperatively, strategies include what we've talked about before, that is management of anemia, limiting phlebotomy, stopping medications that inhibit hemostasis, and a consideration for intraoperative cell salvage. Postoperatively, there's focus on monitoring the patient for acute blood loss, and we need to have a very low threshold to return a patient to the operating room if needed, because transfusion is not an option in that group. I think we also need to be mindful that for surgery, there is some blood loss expected. However, there are several anesthesia and surgical techniques that can be utilized to minimize blood loss. Some of the anesthesia techniques sound simple, but is important, and that is maintaining body temperature, normothermia. A normal temperature is required for platelets to work adequately. It's required to prevent coagulation, and it also helps to maintain hemoglobin's affinity for oxygen. Obviously, we want to monitor their blood pressure, which can affect bleeding, and we want to use the use of volume expanders as necessary. In certain instances, anesthesiologists can use hemodilution techniques if thought to be appropriate for that particular surgery. As far as surgical techniques, I think Beth mentioned it before. Number one is always meticulous hemostasis. Be mindful and careful. Surgery, for the most part, is an anatomic art. And so you need to be mindful of your anatomy. Surgeons may choose to use a minimally invasive approach, the robotic approach, which obviously minimizes the incision and gives a surgeon much better visualization, which will cut down on blood loss. Surgeons have a whole host of specialized instruments they can use, starting with electrocautery, the harmonic scalpel that Dr. Flodine mentioned, where it divides blood vessels without loss of blood. If needed, we do have argon beam coagulation. And we also use topical hemostatic agents that can be applied robotically, locally to the area to prevent or stop bleeding. And one other thing I did want to mention is our very robust interventional radiology department. This is a group of specialists that through small puncture wounds can guide catheters, much like a cardiac catheterization, can guide catheters to the site of bleeding, and they can inject substances, coils, or springs that can stop bleeding. And at Lehigh Valley, we do have a program where we can identify patients with conditions that are associated with blood loss in the operating room. And if appropriate, we can even do preoperative embolization, where we would close that blood vessel to prevent bleeding during an operation. So I hope that answered that question.
Pretty comprehensively. Yeah.
Okay.
Thanks, Pat. I appreciate that. In fact, any one of those things we could pull out for a deeper dive and almost a program in and of itself. So we're looking forward to getting into some of those specific medicines and techniques. I see a lot of questions in our chat about recombinant blood products and alternative medications that don't contain fractions. But really, how we address those and how we can structure an advance directive to address each one of these options according to a patient's conscience and beliefs. We're really looking forward to offering some of those programs or workshop features in the future. Let's just take one more question. Kelly, what about this one? Do we have to wait until we have an appointment with a doctor to contact you?
Oh, this is a great question. I'm glad somebody asked this. Honestly, we want to meet with you as soon as possible, actually before your appointment with your doctor. By having your consult with our team before your visit, you'll be able to be really fully prepared for your visit with your doctor to have a more detailed discussion as to, like what you mentioned, what's on the table and what's off the table for your care. And Dr. Tiselli touched on this too. This will help the doctor, the surgeon, be prepared as to how their plan of care will be for you, knowing this information as early as we can get it conveyed to them. So I would recommend, as soon as your doctor is saying, I think we're going to need to do surgery, or even if you think you might have surgery down the road, hey, I'm a girl who's like, let's be prepared. So please reach out to our team and we'll help you be prepared for your meeting with your doctor.
Yeah, fantastic. Thank you. And I appreciate that call to action. So just the takeaway, it's never too early, right?
Correct.
Okay. So Kelly, thanks for being here with us today. Tell me, if you were to sum up your feelings about our patient blood management program in just a few words, what would you want to say?
I don't know if I can do it in a few words, Warren, but I'll talk very quickly. I have to say, besides being extremely excited about this program, I'm extremely thankful that we have this program here at Lehigh Valley Hospital. It's something that's very personal for me because I can relate to some of our patients and their family members who are anxious and concerned about where they could go when they couldn't travel to Philly or to New York to get bloodless surgery. With my mother and her care, I remember us trying to find somebody that would respect her wishes regarding blood transfusions. So, with that said, I'm sure a lot of the patients that I worked with, I'll say, I'll treat you like I would treat my own mother. I will be by your side through this. I don't want people to feel that they're alone. And knowing now how this hospital, I've been with them for 15 years, seeing not only the desire, but the competency, and having that married together for the Bloodless program is certainly something that I'm very excited for our community to have this.
Thank you, Kelly. And I appreciate all the fantastic work that you're doing to support and care for our patients. I even see it in the chat, the Q&A. A lot of patients are mentioning how much they love being able to reach out to you with questions or concerns about their care. So thank you for everything you've done to advance bloodless medicine and surgery at Lehigh Valley Health Network over the past year and a half. Pat, what about you? Any final comments you'd like to wrap up with?
Thank you, Warren. I just want to say that I'm very proud that we have finally and deliberately established a patient blood management program that will allow patients to receive care in their own community. But I'm even prouder that the program was built on mutual respect in order to satisfy the needs of the patients that it was finally intended to serve. So I do want to thank you for having me today.
Thank you very much to Dr. Tiselli. We appreciate that. Dr. Tiselli was my first introduction to Lehigh Valley Health Network. We had, I think, a 15-minute phone call, and after an hour, we were still talking about his vision for robust patient blood management and bloodless surgery here at this network. And as I hung up the phone, I thought, this guy is the real deal. So I saw that compassion for the patient come through, and it's just been amplified throughout all the rest of the colleagues that we have. So Dr. Tiselli, thank you for being here. Thank you for your tireless support of this initiative and for being with us to talk about our progress and future goals for our attendees today. So like I said, I've had the pleasure to work with just a large team of invested and caring colleagues who have worked so hard to move this standard of care forward. And I'll just have to say that I'm looking forward to bringing them to you in future outreach programs that we have. I really think part of this team you've met, I know you're impressed with them, but there are many, many more who are just as dedicated too. So we're looking forward to having a good relationship with our community and for you to know the providers of care that you're going to have. But as crucial a piece as those providers are, I think right now it might be nice to hear a patient experience. So let's hear from Tim and Gail Hawk. They were kind enough to be able to record a little interview with us, and we appreciate that very much. In COVID, it has made many of our presentations, I'll say, a little less slick than we would like, but I think that the real heart and the real ability for you to be able to see what a patient might experience is there. So I'm going to turn our controls over to AV again, and Max, if you want to play that video for us, we'll see about some of that much needed care from a bloodless medicine surgery champion at Lehigh Valley Health Network.
I am Tim Hawk, and this is my wife, Gail Hawk. And back in January of 2019, we found out that I had a long journey ahead of me. I was diagnosed with stage 4 colon cancer, which would involve multiple surgeries and involved surgeries. And so we began the journey of looking for someone to handle those surgeries that we had trust in, that would also respect our beliefs as Jehovah's Witnesses on refraining from blood products in those surgeries. And this is our story.
Hi, my name is Gail Hawk. Tim and I have been married for 45 years. I have had cancer twice, and so cancer is not new to our home. Tim, when we got the news, I remember thinking, I was hoping it wasn't going to be bad, but when the nurse told us, the doctor and the nurse told me, take your 2 minutes, and then afterward, pull yourself together. You can do this. And I remember thinking, well, I've been through this twice, and we can do it. As a team, we can face whatever we have to face together.
The journey initially began with Lehigh Valley Health Network, with the surgeon that initially discovered the tumor that I had, discovered it was cancerous. We made it clear that as one of Jehovah's Witnesses, I would not allow any blood products to be used during the surgeries. His tone pretty much changed after that, that he wasn't happy about it at all.
When a doctor tells you, I'll do it, but we, you know, not just his demeanor, but things he was saying, we immediately looked at each other and knew this was not going to be easy. We're going to have to do a lot of work to find someone. And that's what led us out of the box, so to speak, and looking into Philadelphia or New Jersey or other places.
During the process of trying to find another facility, another doctor to handle the surgery, continued discussions with my oncologist, who I've had visits with on a regular basis, and let him know what our difficulties were. And he recommended seeing a doctor that had moved up from Philadelphia recently, Dr. Brodsky. He said he may be the one that could take care of this for you.
So we set it up that we could meet Dr. Brodsky. And I have to say, I was wondering how this was going to go. But when we met him, we really liked him. He's a very nice man. And as soon as he knew that we, didn't want to do the blood thing, in fact, I even asked him, are you sure that you are willing to do this without blood? That's when he said what Tim had mentioned, that I rarely ever use blood. I was just amazed at how confident he was. And then he even interjected, and I don't think I could do both surgeries even at once, which surprised me because we had already faced where the doctor before that said I'd have to do only one surgery and someone else would do the other. Dr. Brodsky was very confident that he could do this. And so leaving his office, it was like a sigh of relief that this was an answer that we've been praying for, that here he is in the Valley, at Lehigh Valley Hospital, and he's willing to do what we asked and didn't have any problem with any issue at all. Surgery started, it would take about 5 hours. Dr. Brodsky even let me know kind of midway how things were going, which was a wonderful relief because you worry. But when the surgery was finished and Tim came out, he looked, pretty responsive even, despite what he had been through. I counted 70 stitches almost. So it was quite involved surgery. But at the same time, Dr. Brodsky was so confident even when he came out and told me that everything went fine. Tim even was up and about like the next day. We have photos of him walking down, in the hallways. So that was such a relief. And, the confidence that he had wasn't just words. He really did what he said he would. He respected our beliefs. And I think he actually enjoyed doing this surgery because it was a challenge. What do you think?
Mm-hmm.
What did he say to you?
I think we didn't realize how involved the surgery would be. As much as they explain it to you beforehand, it's afterwards when you see the damages that, when you're cut from here as far down as you can go, that you were thinking that you were that laid open, for him to do that, and he didn't need to use any blood. I just find that amazing that he was that capable, that he could do it. Even though we had found Dr. Brodsky, naturally we had other reservations about Lehigh Valley because of its sort of bad reputation, that it wasn't always working with the brothers. Sometimes legal things were involved. And so we were happy to find out that about the same time that we discovered Dr. Brodsky's involvement in our case, that the bloodless surgery program was being established at Lehigh Valley as well. And so we were put in touch with the liaison, the patient liaison, to guide us and help us getting those things established. And she actually did so many things behind the scenes that we couldn't have even begun to think of and ask for. There was, went much further than just finding a doctor.
That was such a help, because having her by our side, if I had a question when Tim was even in surgery or when he was finished, I felt confident that she'd know, who to ask or how I could find out the information. So it was like having this buddy next to us as support. I felt it was invaluable, and she probably has no idea how much that meant to us, even though we said we appreciated it. It's a wonderful thing to have in place along with the bloodless surgery program. After the surgery, Tim was recovering. I have to say everything went great, and we were so happy about that. But I was wondering now during his recovery, because this would be a long recovery. We were there 9 days. I was wondering if we were going to be treated differently because we're witnesses. Even though we had, everything in place with the bloodless surgery and everything went well, you still, wonder, because people have their misconceptions and everything. And the nurses, when they would come in, if they weren't always familiar, I even heard them talking like, oh, this is the Jehovah's Witness, no blood. They were fantastic. Their attitude was good. They didn't feel, you could see that they were being kind. They knew not to take too much blood. They had little pediatric vials that they would take blood out of. They didn't complain. They did everything very well with their job. And I thought they were very kind to us, even. To me, they were kind to him. If he had an issue, they took care of it immediately. So all my worries were gone, because I was just amazed at how wonderful they were treating us. And it was such a relief.
So it showed the scope that the bloodless surgery program had. It wasn't just a doctor. It was the doctors. It was the staff. It was the anesthesiologists, the nurses when they brought you in for surgery in the prep, the nurses afterwards. Everybody was being educated.
Yes.
To how to treat witnesses.
So through this whole process, we felt like you expect that you may have problems. Even though, I had said before, you feel you covered all the bases, you still feel like there might be something that is going to happen because we are witnesses and we don't take blood. But through it all, when we look back in our journey, we had a partner in care. It went better than we could have imagined. Our prayers definitely were answered. And we're just so happy that Tim is here today, because of the program, the bloodless surgery program, and everybody involved. We really did our homework, and Lehigh Valley really did earn our trust.
What a great couple. I really appreciated getting to know the Hawks a little bit better. And our thanks goes out to them for sharing that perspective and their experience. So I think we were probably a little bit closer on our WebEx when we said from 3 to 4:15. So we're nearing the end of our scheduled time. I just wanted to let you know about maybe we could say a special behind the scenes video, and that features Tim and Gail's daughter, Terry Ackerman. We're going to play that at the conclusion of our program today. So if you have the time to stick around for 5 more minutes afterward, you're welcome to view her story. If not, we'll send you a link to it later. But more and more of us are becoming, if not full caregivers, more active participants in helping parents decide on courses of treatment. And her perspective gives a nice insight on how the right team can make that role a little bit easier. So I'd like to thank Dr. Flodine and Dr. Tuselli for being with us today, Kelly as well, and all of you attendees. We had 360, it looks like, participants at one time. And as we've relived some of our journey to bring bloodless medicine and surgery to the Lehigh Valley, you met just a small fraction of the colleagues who have worked tirelessly to bring this vision to life. But we're looking forward to more events like these in the future, where we dive deeper, where we speak with more experts, where we show you that when blood is not an option, that you really do have an option. It's compassionate care close to home at Lehigh Valley Health Network's Bloodless Medicine and Surgery program. So reach out to us at any time. We're here to help you. We've got a team that is waiting to assist you to answer questions. I see a lot of questions in the Q&A we weren't able to get to, but we'll be reaching out to you in the next week or so and make sure that we connect you with the proper response soon. In the meantime, feel free to view our website. You can get more information. You can download some of those educational materials. You can watch patient experiences there or read some of them. And again, as we mentioned, some of our closing slides will have more details for you. But we just wanted to thank you again for joining us today for our Bloodless Medicine and Surgery educational event. And it won't be the last that you're invited to at Lehigh Valley Health Network. Thank you so much.
My name is Terry Ackerman. When my father was initially diagnosed with cancer, we knew that it was going to be a difficult and long journey, especially since we had already been through the treatment with my mother with her cancer twice. So we knew that this was going to be a struggle, not only to find good care, especially for the bloodless surgeries, but how long the treatment would be involved. We knew that it wasn't just about the surgery. There was a lot of treatment, a lot of appointments. And I personally really wanted this to be as close to home as possible because we're a close family and, you know, we want to be each other's support system throughout this whole thing. And having a young son who's homeschooling, it wasn't exactly feasible for me to have to travel a long distance and still be able to give the amount of support that I knew that they would need and also I wanted to give. Actually, I had gone to the first surgeon's appointment with my family. In talking with him, we realized that he was not going to want to work with our needs as far as bloodless surgery was involved. So as a family, we all pretty much at the same time looked at each other and were like, this is not going to work out. We're going to have to find something else. So I remember being in the hallway while my dad was in making the appointments and my mom and I, what are we going to do? Who are we going to find to do the surgery? If he's not going to work, how are we going to figure this out? All of a sudden you're flooded with so many different decisions while feeling emotional and stressed and anxious. And so it was a very difficult time in that moment because you hope that the first doctor you find is going to be the one that is going to just say, yes, I'll do everything easily and your problems are solved. But that wasn't the case. And so we realized we had a lot of decisions to make. When my father was considering a doctor, maybe in Baltimore, it was a very stressful time for my mother and I, especially because knowing that we were going to want to be the supportive care for him, there would be a lot of travel involved, other expenses, time away from my family. I knew that she would want me to be there to support her during the surgery and then to be there for my father after the surgery. So when I found out that he was considering a doctor here at Lehigh Valley, I was so relieved because I knew, okay, this is literally like 7 minutes away from my house. I can do this. You know, it won't cost extra money. It's not going to take a lot of time. I could be there every day, go home in the evening to my family, and this was doable. So I was so relieved knowing that we could get the care that we needed here close to home. The thing that I appreciated the most about the Bloodless surgery program was that they took care of and handled all the little things that we didn't want to have to be worried about. We were able to feel secure and confident in the process and just be able to focus on my dad's recovery.